888-239-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, welcome to the Becky and Boca Show. New time. I'm now at 7 p.m. on Thursday nights, and we've picked up some more stations, some more FM stations. So we're expanding. Tonight I have two beautiful women in here, Carissa and Jennifer, and they are from Fifth and Wellness, which is a local wellness facility. New, right, ladies?
Yes.
3 months.
3 months old. Okay. And glamorous downtown Boca, which I love. And believe it or not, this is mother and daughter, which
I know, no one believes it.
No, I know. I remember when you walked in, you had told me that before, and I'm like, no, that can't be right. They must have brought somebody else.
It must have been a typo.
you look like you're 20 years old. Okay, so your facility is a wellness facility, a spa, med spa. I don't know what kind of medical facility. Okay, and you are a physician.
I am.
Okay, and you said you have 5 core services there. You want to tell us what they are?
Yes.
So they're acupuncture, aesthetics, weight loss.
Aesthetics is the facial injectables.
Yeah, so full
Okay.
aesthetics. So,
Okay.
like facials, chemical peels, body contouring, injectables, all lasers. And
Okay.
then we have acupuncture. We do really big facial acupuncture, which Tricia will elaborate a little bit later. We have
Okay.
weight loss, IV therapy, and then hormone replacement therapy.
Oh, wow.
We offer.
Got everything. All my favorite things.
Yeah, everything that you need.
Okay, and let's explain where you are. You're in downtown Boca, 5th Avenue, which is
yeah.
south
It's
of...
Meisner Boulevard, so that it's straight.
Oh, so Meisner Boulevard comes around and turns into 5th Street.
Right.
I've lived here all these years and I didn't realize that.
Right,
Okay,
right.
so you're
Right there.
basically
Right behind
5
South.
blocks south. I think he wants to get a little closer to the mic.
Sorry.
5 blocks south of Palmetto Park Road
Yes.
on Federal Highway, and you are on the west side of the street, right?
On the west side, yes.
And you
Behind Locale.
behind Locale. Everyone knows where Locale is.
Yes.
So
They
it-
really do.
Yeah, I know.
Yeah.
That's a downtown
As soon as I
landmark.
said it, they're like, oh, I got it. I know.
So you are downtown, but you're not too far from the beauty lounge. Which is, pull the mic. Which one?
This one?
They working? Okay.
Sorry, keep talking.
Okay. So it's right East Boca Raton, downtown. Hello, Dawn.
I just want to make sure we can hear this.
You wanna come
Thank
visit?
you, Thank you.
Okay.
Appreciate it.
All right. All right. Okay, we're back in business. Okay, so the 5 core services are acupuncture, aesthetics,
Yes.
and
IV therapy.
IV therapy,
Hormone replacement therapy.
weight loss.
And then
and
weight loss.
Okay,
Yes.
I almost got them. Okay. But you do some specialty things. I know you wanted to talk about a couple of them. One is the Morpheus 8,
The Morpheus 8, yes.
which is that a skin tightening device? Yeah?
Yes. Okay, the Morpheus 8, it actually morphs your skin. It's
Okay.
radio frequency with microneedling. So it's 3 sessions, branched 4 to 6 weeks apart, and there's no downtime, which is key. That's what everyone's
Which
looking
a
for.
lot of
it's
people are loving.
microneedling.
It's 24 needles that penetrate the skin
Okay.
with the heat component. So it's meticulously placed, and you can do all over the body. It's not just face.
I was going to ask you about that. It's not just
Right.
tightening the skin on
And
the face.
it doesn't dull, so you can do face, neck, elbows, knees,
Stomach.
stomach,
Legs.
butt,
Wow.
cellulite.
And is it
old
instantaneous, or
scars.
does it take
It
a while to see the
takes
results?
time. Well, you get an immediate glow and the tighten and tone, But you overall see like things in like 2 to 5 weeks.
Yeah, I feel like it
in
depends
between.
on the area as well. And from what we're
Absolutely.
hearing from a lot of our patients, especially if they do the face, they're saying, in the first session, they're not seeing it as much, but their
Other
colleagues
people
and
are.
friends and people
Yeah.
are complimenting them. And then when they do that second session, they're like, wow, okay, now I see it. I'm hooked. And then they do the third session.
Well, I
and they're
know
in love.
microneedling alone works. Now,
Yeah.
this is microneedling with radio frequency.
Right.
So you're putting a source of heat down into the...
Right, exactly.
into the
So
skin.
you're getting the toning component in there, and it's just amazing. And a lot of people are like, well, I don't really see anything at first, but then when we show them the post picture, they're
Yes,
like, wow.
when they
And
see
then it
those-
develops
And the
over
fact that
time.
there's no
yes,
downtime,
builds collagen.
that's also very.
No downtime is important because the one microneedling I saw, that was kind of
Right.
scary for a while.
Like that. The old method was the vampire.
Vampire facial, yes.
facial.
Yeah, you
And
get
it,
great
you know,
results, but it
Very
was,
effective, yeah.
very
so,
effective.
so
Very.
this is a more modern version without the downtime.
Absolutely, it's
Because
very
we
advanced.
had a lot of patients that would come and say, "Listen, I love my results. I loved the treatment, but
the
with my,
downtime.
with my schedule, my lifestyle, I cannot.
just can't do that
Yeah, I
again."
can't.
for sure.
So it was definitely a big issue that we kind of came across. But now that we have the
Yeah.
Morpheus and it's virtually no downtime, they're loving that component with it.
Okay.
Mm-hmm.
A couple other things. You want to talk about the acupuncture a little bit, I heard.
Yeah, so
because
I was trained both Eastern and Western, and I just specialize in the face only. It's what I like to do.
got to move this up
Okay,
a little bit so we
sorry.
can see her face.
Okay.
Oh, sorry. Yeah.
All right.
Okay, there you go.
So what I found is that it prolongs the life of the filler and the Botox.
You were
doing-
telling me that
Right.
by doing acupuncture, you can prolong the life
It
of filler and
just-
Botox.
It just stands out. Your skin looks so much better. It stimulates collagen. You glow. It's blood flow.
A little more.
It's just
talking.
okay. I feel like I'm having a defective mic here.
Maybe you can move up a little. I'm just trying to get
This
you in
one?
the shot.
Okay.
Okay.
Yeah, move
All right.
forward a little.
I'll
There you
move
see how-
forward. Yeah, there we go.
Okay.
Okay, good.
There we go.
So the blood flow, collagen stimulating, the needles, it's painless. It's
I've had
just-
acupuncture. It's
okay,
great.
In the
Yeah.
face?
Mm-hmm. Yes, I
Okay.
did.
So it just prolongs the life of the Botox and filler.
Okay.
That's what I found.
I had it in the face for relaxation,
Mm-hmm.
and that night I slept like a baby.
Right.
Before that, I didn't. Not that I was a non-believer. I just didn't think
No.
about
Yeah.
whether
I
it worked
know.
or not. I
Yeah.
just decided
You
to
didn't
try
go
it.
in
You
thinking
have
it was
no
for that,
idea.
yeah.
People,
And-
even I am, sometimes I'm thinking like, how does this even work?
Yeah.
But, when you look at yourself in the mirror and things just look different and you realize that you haven't done Botox in, 6 months, you're like, wow, where I used to be every 3 months.
That's
you can
fantastic.
Prolong it for another 3. It's cost effective. And,
Right.
And it's painless.
sure.
And it's something different. And I like doing that. It's alternative. And a lot of other people that I've recently have come across that they don't want to do Botox.
Mhm.
So everyone is like, oh, how could you not? But some people just don't want to. Like, people that have, just don't want to. They want an alternative.
Right.
And I do a lot of homeopathic fillers as well. So
What's a homeopathic filler?
it's just. Oh my God, I'm so sorry.
That's not you.
Okay. All right, thank you.
Okay, there we go. Now
There
we
we
can
go.
Okay.
Now we can see Carissa.
right,
Okay, a
sorry.
homeopathic filler.
Homeopathic filler is, it's just like made from sheep's placenta. Yeah,
Okay.
that sounds odd, but
Huh.
it's just homeopathic and it's from a sheep. So
okay.
yeah, we can talk about that later.
Does the same thing as regular
No,
filler?
it stimulates collagen
Okay,
over
okay.
time.
Okay.
But it's something, it's not. It's like filler, like Juvederm or something. It's like air in a tire. It's immediate, where the natural things take time.
Yeah.
So that's why some people want the immediate gratification, and they don't want to wait for the alternative.
Okay. Okay. So you offer that too.
I do.
Female injectable testosterone was something we were talking about in the green room, and I thought
Yeah.
that was very interesting because I've had people on the show talk about injectable testosterone for men.
Yeah.
Right.
But I didn't know women could do it too.
Yeah, so when everyone, assumes testosterone, they think automatically, oh, it's not for a woman, it's for a man. And they think, big, strong man, they're going to get muscles. That's just like kind of the vision that they see. So, for females, obviously, we want to fix the hormone imbalance, kind of get them, to the optimal level. So in the past, we have we still have hormone creams, we have hormone pellets.
Right.
But a lot of, physicians or even, people themselves, they don't know that there is a low dose testosterone made solely for females. And I personally think that that's just the best we've seen the amazing results and turnarounds
So
with our female patients.
what's the difference then between using it in a cream and using it as an injectable?
It's more about the body's absorption.
Right.
You know, you can get it, you know, they do the shot once a week, and we just see within that first, you know, shot, a lot of women are like, wow, I can already see it in my mental, you know, clarity. I can see it in my energy.
It's also
you know.
To the pellet. The pellets are, they're surgically put in.
Yeah.
And if you are dosed too high, then you become estrogen dominant.
Oh, boy.
And
Yeah, the
then you have to
injectable is
wait it
totally
out.
customizable.
Okay.
So, you know, they're going to dose you after, you know, we'll do your blood work first. You'll come and review it with one of our physicians, and then we'll go ahead and dose you based on your levels and what you're kind of looking for and your overall goal is. Obviously, we'll do your first injection. You know, we'll obviously, you know, kind of keep track on you, make sure that, you know, you're on top of your, your plan, and make sure that, you know, you're feeling your best. And if for some reason you're like, you know what, I feel like I could have a little bit more, we can up it.
Tweak it up.
You know,
Oh,
And
with
it
a
is
pellet,
all
you
about
can't.
feeling good.
Right.
100%.
That's what the
Yeah.
testosterone is like, night and day for people. That
Yes.
Skin tone,
mhm.
the elasticity.
Yeah, they see it in their muscles. You know, I see so many women that are now back in the gym, and they're like, I feel so much better, like I'm back in my 20s.
Yes.
You
yes.
know.
And is it safe as long as it's monitored?
Yes.
Okay.
Monitored.
Yes.
Yes, it's not for everyone. That's why you have to
You have
a
to
doctor.
you have to know the blood
you have
levels
to know
first.
Yes,
before
we
you-
always do blood work
Yeah.
first before we even kind of
Even
talk
for
about
weight
that.
loss and the peptides and things like that, you have to always check your lab 1st. Always.
Yeah.
So tell me about that peptide for weight loss. Someone would come in, you would check their labs.
Yeah, we always do
then-
initial consultation first. We
Okay.
offer complimentary consultations. So they would come in, they'll kind of meet with our physician, you know, figure out what are you coming in for? You know, is it weight gain? Is it, you know, whatever, you know, what are you experiencing? And we'll figure out, okay, most of the time we're then going to venture into labs. We always like to kind of see a patient with labs within the past 6 months, sometimes sooner, just depending on what they're coming in for.
Three
Yeah.
months max.
And then
Months.
they will
Okay.
come in, we'll do a consultation. If they don't have labs with them, we'll go ahead and order labs. And then
we
they'll
do
come
that
back.
in-house. We do everything
Yeah.
in-house.
And then we'll go
Okay.
ahead and have them come back with the physician, review everything, and then we'll figure out a peptide. You know, most people, when they think of weight loss, they think of diet pills, they think of phentermine, you know, then now they'll think of, you know, the
And
vitamin
also
injections.
peptides are thinking of Samorlin and things like that.
Yeah.
There's other
Yeah.
ones out there
You were telling
too.
me there's a lot of new ones.
Yeah, so they'll think of
Okay.
like, you know, the lipotropic injections, which is MIC and B12, which are great, you know, additives, but that's what a lot of people just kind of assume. They don't even think about peptides. And peptides are such a great way to kind of boost your energy, burn your fat, speed up your metabolism, and just really kind of help push you to get to that goal that you need to be in.
Wow.
Yeah.
This is all very exciting.
Oh,
I
it's
know.
so
There's a
exciting.
lot.
And there's
There's
so
a
many
lot.
peptides that are out now.
And with the peptides, are they injected?
Yes.
Okay.
So
Daily?
when they first came out, they were injected.
Okay.
And most of them are daily. Some of them can be weekly. It just depends on what you're getting.
Okay.
Now, a lot of people, you know, are still afraid of needles. They don't want to be injected every day or weekly. They have them in troches. So, you know, you can have them
A
dissolvable.
lozenge. Okay.
Mhm. So it just kind of depends
I'd
on the
rather
pharmacy that you're
inject it.
using.
Yeah, I used
Yeah.
Samorlin for quite a while, and
How
it
did you
didn't
feel?
bother me. I felt great.
Yeah. See?
And it didn't bother me doing the injections at all.
Yeah.
Once you get used to it, it's,
Yeah.
it's
the
nothing.
creams are messy, and then it's you have to wait for them to dry
Yeah.
before you put your clothes back on.
Mm-hmm.
So I would
Yeah.
just rather a shot. And
I had
the
a
pellet-
patient who, you know, came in the other day and she met with one of our physicians and she got on a cream and then she called me a couple weeks later. We followed up with her and then she's like, actually, you know what? I actually fell off. She goes, you know, I just forgot, you know, life goes on and I just forgot. I need to do something else. And so we're like, all right, come back
Injections.
in. Yeah, injections.
Yeah,
Well,
Yeah.
I don't know.
Yeah, there's
That's
just so
great.
many different ways that you can go now. It's not just the standard that, you know, we would all three be on the same
Yeah, it's
thing.
not cookie
Everything is
cutter.
so
Everything
custom.
is just
So
custom.
someone
coutoured.
would come in, your website and phone number are up there on the screen, 409-3128.
Yes.
For people on radio, 561-409-3128, and it's fifthandwell.com, 5THANDWELL.com.
Great.
So someone would make an appointment, come in,
Right.
you would do blood work, you would talk to them about what their issues are.
Yes.
And then you would figure out,
When they come back for their review, which is about in a
Okay.
week.
Okay.
And then we'd come back in, do a really thorough analysis with one of our physicians, and then we would figure out what's the best option for them.
Yeah, like
Okay.
people, even like something random, patients coming in, he was getting plastic surgery. And then we decided to send over a concierge service to do IVs at his home for post-care for healing.
wow.
That's another service that we do as well.
Oh, that's interesting.
Yeah, concierge, yeah.
I just saw that on the back.
Because, we're so busy.
Okay.
You know?
But I don't know if you can see the bag here.
Yeah, we're so
Beautiful.
busy nowadays,
It's a well bag.
so when you
Right.
can have something that can come to you, I think it's just so much better.
Yeah. Plus, if you're recovering from surgery, you might be
Exactly.
And it's so great for your post-care and
Is it?
recovery
Okay, I
so
had
much.
Like
never
we
even
had
heard of
someone,
that.
he came in for 2 prior to having surgery. And then after that, he did a package, a few, I think he's on his first one.
Okay. So what
tomorrow.
is in that? It's an IV, correct?
Glutathione,
High-dose
high-dose
C.
vitamin C, so that helps with, recovery, skin,
Different amino
connective
acids.
tissues,
Yeah.
healing, bruising,
Mm-hmm.
inflammation.
Okay.
So,
Yeah, we have a menu of different IVs that we have, and they're all kind of curated for different things. A hangover drip if you're sick. We have a weight loss IV. Just
Before
kind of
you
depends.
travel
Yeah, before you
also?
travel.
Oh, a weight loss IV. Mm-hmm. How does that one work?
So it's still everything that we do in our office. We always recommend a consultation because it's so funny that let's say if I tell you, oh, I got this amazing laser, you're going to say, oh, I want the same thing. But when you actually come in and kind of converse with us,
Yeah.
we're going to say, based on what you're looking for in your past history,
some
you're
people
going
are
to
on
need something
medication
different.
that contraindicate.
Yeah.
You can't have that.
Okay.
So you have to be careful.
So that IV, to go back to what you were asking, it's high dose hydration. That's such a big thing is hydration. And then we'll do
okay.
different amino acids, B12. We'll do like a little bit of
And there's 3 types of
carnitine.
B12. Like
Yeah.
there's different levels. So anything like the Sino, that's the cheaper one. That's what you can buy at Target or
Okay.
And then there's the hydro, and then there's methyl. And it's all the way that your body metabolizes it and breaks it down. So it's better. So
Oh,
you can
I
use
didn't know
all
that.
of the B complex
I'm
together.
learning a lot.
You learn something new every day.
Yeah.
So,
there's a
if
lot.
someone's just feeling run down, these IVs can help them?
Oh, perfect.
And even a shot, like
Ooh.
we had a rep come in today, and she's just not feeling well. And I kind of made her my own little thing. I did a little bit of lysine, a little bit of vitamin C, and a little bit of lidocaine because it burns. And I do it on her.
I swear I've not been sick, and I have such a
And that's just
horrible
a shot. That's just a
Goodness.
low
shot.
immune system. Like
You're
I was always
kidding.
sick, like every other week, and now I do these shots. Anytime I feel that I'm getting sick, I'll do an IV or I'll do a shot if I don't have time or we're just kind of
Right.
like last minute. And I'm
That's
telling you, the next
There's
day
a
I
trick.
forget that I even felt
Or
sick.
you can do like taurine before a workout. You can do L-carnitine. There's a lot of little amino acids that you can do that are all, IM injections, intramuscular. And,
Okay. Yeah, I didn't know that.
Sorry.
Okay.
Yeah, there's
Oh,
something
here we've got
for
a picture of
everything.
your Morpheus 8 up on the
Yeah.
screen.
Okay.
This is the microneedling of the face.
Yes.
Right.
Okay.
Okay.
That's the
That's the handpiece.
handpiece. Okay.
So that's 24.
and
okay,
these are
perfect.
the little
Those are the
needles. on
needles,
there.
yes.
Okay.
So the little heat sensors there are basically penetrating to the dermis.
Mm-hmm.
So epidermis to dermis, that gives the tightening.
Yeah.
Yeah.
Okay. All right. Thank you, Freddie.
So every time that
you,
they'll kind of
Freddie.
stamp and do a pulse,
Yeah, thank you.
the needles will penetrate down into the dermis and heat it up at the same time.
So
Yeah.
just to let everyone know, it does not hurt. So you would come in 30 minutes prior, and then we'd apply
Topical
a
numbing.
topical
Numbing agent. Okay, I
compounding.
saw that in the video.
It's BLT, benzocaine, lidocaine, tetracaine. So it's good. So max time 30 minutes. Then we wipe it off, and then we
Go ahead and do
you
the
know,
procedure.
And yeah, there's no pain and there's no downtime. You're
Yeah.
red for like the hour.
Like a mild pinkness. We
Can't do
did a
that.
little, we did like a little
Yeah.
pop-up event
and
back
also
in
we
October.
do the mask after.
Yeah.
Oh,
So-
okay.
Because it
there's
kind
like a
of helps pull
mask.
out the redness.
Right.
And then,
Uh-huh.
depending on the time that you're doing it, if you have like other activities after,
And
we'll
people, like,
do
someone
a
went to
topical
lunch
sunscreen.
Today. I did it, and she went to lunch with her friend right after. So
Literally.
it's
That's
nothing.
my kind of treatment.
That's why. Also, the facility.
It's beautiful, huh?
Yes, it's amazing. So my husband is a builder,
Okay.
and he had this office space in Boca. And being that we had a past clinic out west, my daughter and I, he said, let's make a clinic.
Downtown
And-
Boca. It's a
oh,
great location.
My gosh.
Part of
The
everything.
facility
Yeah.
is beautiful. He spared no expense with the equipment and what he's done. I mean, you have to come and see it. It's beautiful.
So people go check it out.
Absolutely.
It's on Fifth Avenue, which is Meisner Boulevard.
Fifth Street.
Fifth Street,
Fifth
right?
Street. Yeah.
Okay, make that distinction. Fifth Street, and it's at the
Right
corner of Fifth
behind
and Federal,
Locale.
behind Locale.
Yeah.
Okay.
There's Mark Timothy Homes, and then we're the second one. And there's parking, which is
Okay.
huge in Boca.
That is big. Yeah, that's
Because
very
there's
important.
no parking.
Yes.
Yes.
Yeah, usually, but it's right in front, so you don't have to worry about being towed, for sure. But yeah, and also we have the dermal infusion, which is great. You want to talk about
What's the
that?
dermal infusion?
So a lot of people, really, if they know about it, they know, and they know how amazing it is.
They
But a lot
think
of
it's a
people know the
hydrofacial.
hydrofacial.
Yes,
So,
yes.
and that's so
That is
popular.
great.
Everyone knows that by that name. But so the dermal infusion, what sets it apart from the hydrofacial is that a lot of patients, when I converse with them, kind of giving them education about the dermal, when they've done the hydrofacial, and even myself when I've done it in the past, you just feel like it's very surface, treatment. You don't, you feel nice for the next kind of 30 minutes, an hour, and then like, okay, I don't really feel like I got a deep cleaning.
Yeah.
So with the dermal, it's a 3-in-1 technology. So it extracts, exfoliates, and infuses the skin. So there's custom serums that will not me, but our estheticians will pick, and based on your skin type and your overall skincare goal. So there's a hydration serum, a vitamin C, a pigmentation serum, and what is the other one? There's all different serums based on for your skin type. And then basically, as they're doing the treatment, every pass that they do on your face, it's infusing that serum deep down into the surface. And then it also promotes more collagen, kind of promotes that plumpness into the skin.
Wow.
You can do it on the body, anywhere.
Yeah, and it also has a
Lips,
microdermabrasion component in that handpiece too. So that's kind of like that exfoliation. And then it's also extracting your debris and any acne, and it can go over active acne during the treatment.
This is very
I
exciting.
know.
And
I'm like hearing this, and I'm like, I want to go there.
Yeah.
Yes.
And then the great thing is, I know it's kind of sick, but you know how everyone likes to watch the pimple videos being popped on
Yeah, I know.
Instagram?
I haven't, but I've
Dr.
heard
Pimple
about- yeah,
Popper.
Pimple
She has a show now.
I know, I've
with
heard that.
with this machine, every time that they're doing the treatment, there's a jar that's collecting all of the debris, the specimens, and everything, and you can see the color of the water when you're done.
What came
You can
off of
see
your
all your
skin.
blackheads and all your
People
pores,
like Boca, and they spin it around.
and it's just so gross. But it's
Yeah.
kind of like,
Shows you what was on your face. That
it's
can
kind of
come off.
relieving because you're like, wow, it's not in my skin
It's
anymore.
gone.
It's gone.
Right.
Wow.
Yeah.
I don't even know where
It's
to-
one of our most popular services, and when people after they're like, okay, I can see why your skin is so smooth. You have such a nice glow.
Yeah.
And it's just great if you have anything like trapped acne or anything like
Before
that.
their wedding, they come and usually do that,
Yeah.
or like an event.
And we do a lot of teenagers. A lot of teens are facing acne.
Right.
Their parents will kind of come in for themselves, and then they're
And
like,
then
wow,
they
I
learn
gotta
about
get
it.
my
Prior
kids.
to Accutane, a lot of people yeah, I mean that's the most best drug, but it's also can be the worst drug. So I would definitely do dermal if you can prior to anything like that.
Wow.
Yeah.
Okay.
For teenagers.
Yeah. All right.
Yeah.
Anybody struggling with acne down there? This is certainly certainly good news.
Yeah.
Okay. So the facility again, you told me is beautiful. People have
It's
to come
beautiful,
and
yes.
take a look at it.
Yes.
It's like Vegas. That's what
You said
that's,
like Vegas. Okay.
that's the first
Like
thing
the
I
Wynn
thought of.
Hotel.
yeah, Wynn,
like the
Aria,
Aria.
very modern, very sexy, but very
It's sexy,
clean.
and it's not
Okay.
intimidating. Like when you walk in, it feels very clean. It's not overdone. It's done, with class, and it's just very clean.
And this is
state
just
of the
based on
art.
what we hear from patients that walk in.
I like the fact that you have so many interesting things there. I mean, people should just come by and
just get a tour.
and talk to you about
it's
what
like a museum.
about what you can do. So I'm going to go over this again. You've got your 5 core services. That's acupuncture,
Facial acupuncture.
facial, and injectables. You call it
Aesthetics. Yeah.
aesthetics. That's
Uh-huh.
the Botox and filler that
Yeah.
we all
Right,
love.
right.
Yes.
And you do
Weight
Hormone
loss.
replacement therapy.
hormone replacement therapy. Very, very important. If you're
Yeah.
not doing that,
You need
and
to.
you're over a certain age, you're crazy.
Your quality of life is not that good.
Yeah, and you don't realize it until you do it.
Yes.
That's
For sure.
That's very important.
For sure.
And you also do. I think we have a couple minutes left. Okay,
It did go by.
and you right. It goes fast, doesn't it?
Yeah.
And the dermal and the IVs, and the IVs
IV
are
therapy.
for
Yeah, IV
everything.
therapy. Yeah.
Sometimes people are like, a little bit naive, and they're like, well, I don't know that this is for that. I'm like, no, this is for prevention.
Mm-hmm.
And that's very big now. You want to prevent.
Right.
Why wait
Yeah.
till the
Yeah.
very end?
Mm-hmm.
Yes. Yeah. So IV therapy, hormone replacement therapy. I know it's a lot to think of. Acupuncture, weight loss, and aesthetics.
Okay. Well, those are all very,
Yep.
very important things, and I'm
Yes.
so glad I met you too.
Yes,
Likewise,
likewise. Thank you
thank
for
you.
having
Daughter.
us.
Yeah, and you're everything you talked about is the kind of stuff I love, and that's what I love about Boca Raton
Yes.
Yeah.
is that we have all this stuff available. It's not
Yes.
like this all over the country, so
No.
very lucky
Thank
if you're
you.
around here.
Yes.
And you do men and women, I presume.
Yes, men and women.
Okay.
Men and women,
Okay.
yes.
It's
Very
funny.
important.
all the women come in and then they're bringing their husbands in, and then it's
And
just
I
funny.
like that men are starting to care about their
Oh,
faces.
I think that's
Yes.
fantastic. Yeah.
You know, like
They need to.
They're doing
skincare,
Botox and they're
Yeah,
skincare,
Botox,
Botox,
right?
yeah.
We did a little video on that.
Yeah.
Skincare and eye creams very important.
Yeah. Okay.
Yeah.
All right. We got
Thanks,
to run,
Betty.
everybody.
Thank
this
you for
is
having us.
Fifth
Thank
and
you.
Wellness.
Yes.
Stop in and see them.
Thank you.
Okay,
See you next
bye.
week. Bye-bye.
Bye.
You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See